point to make. So dots and globules, you're going to see lots of dots and globules, and they can be different colors. Depending where melanin is, it could be black, brown, gray, or blue, related to melanin, and also they can be pink or red if they're milky red globules. So once again, dots and globules could be regular or irregular. Dots and globules, here we have brown, regular. Dots and globules, they're regular because they're more or less the same color and the same shape and symmetrically located in the lesion. This is the globular pattern. It's the most common pattern found in children. And here we have a variation, the cobblestone pattern, where the dots and globules are more or less regular. Another example, you might think they're irregular. So with experience, you'll get more experience. Some people would say these are irregular, but I would say they're regular brown dots and globules. They look more or less the same size and shape. And this lesion over here has regular brown dots and globules at the periphery. And when you see that, that creates a differential diagnosis. So you can see regular brown dots and globules at the periphery of the nevus, Spitz nevus, or dysplastic mole. And a point is when you see regular brown dots and globules at the periphery in a child, that usually means it's going to be an actively changing mole. So if you take the baseline image and then you follow it over time, it will change. If you see this pattern in an adult, it's been my experience that it's a red flag for concern. It could be a dysplastic mole. So here we have irregular brown dots and globules. They are irregular because they're different sizes and shapes, and they're asymmetrically located in the lesion. And that's the definition of irregular brown dots and globules. Irregular, different sizes and shapes, and asymmetrically located in the lesion. Another example of irregular brown dots and globules in melanoma. Why are they irregular? Because they're different sizes and shapes, and they're asymmetrically located in the lesion. So here they're not as easy to see, but here they're very dark. So we have black or dark brown, light brown, but they're round structures, and dots, of course, are smaller than globules. And they're irregular in size and shape and asymmetrically located in the lesion. So I want to just bring this case back because it's a comparison of irregular brown dots and globules, and here we have little pinkish, out of focus dots and globules. And these are referred to as milky red globules. So when you see pinkish globules, they're called milky red globules. You can see gray dots and globules, and this is called peppering. Anytime you see color that's gray, it means something is happening in the papillary dermis, and it represents melanophages and free melanin in the papillary dermis, and it's not unusual to find that. Bigger than dots and bigger than globules are blotches, and they can be regular or irregular. And here we have a regular blotch, dark color filling most of the lesion. If you see, typically in younger people, a little mole and it has a very shiny black color, this could be what we call the black lamella, which represents pigmented parakeratosis, and you can scotch tape that away, the black lamella. And here we have another example of a regular blotch, which is uniform dark color filling most of the lesion. Another example of regular blotch in the benign mole, just dark color. So dark color is not always bad, especially if it's regular and filling most of the lesion, and we don't see criteria for anything bad. Then there's irregular blotches. They're dark. Why are they irregular? Because they're irregular in size and shape, and they're asymmetrically located in the lesion, and they're very dark, and you don't typically see local criteria. You don't see pigment network, dots and globules. Here's another irregular blotch, larger than the dot, larger than the globule, dark color, but it's irregular. And this melanoma here, we have a large irregular dark blotch next to some irregular dots and globules. So you have to learn the definition of what is regular and irregular. And here we have another example of irregular dark blotches. They're different size, they're irregular in shape and asymmetrically located in the lesion. And you can see they're bigger than these irregular dots and globules. So those are irregular blotches. The next criteria I want to talk about are streaks, and they're linear projections of pigment at the periphery, and they could be regular or irregular. This is the only criteria that is not really the shape that determine if it's regular or irregular. It's really their distribution around the lesion. So regular streaks are symmetrically around the lesion. That's how they're defined. And here we have irregular streak-like projections at the periphery. And these would be called pseudopods. They're just like linear projections with little globules at the periphery, as opposed to these regular streaks, which are linear and fine, and these would be called radial streaming. You might try to use those terms, but many times you really can't determine exactly if they're pseudopods or radial streaming. So now most people would just call them streaks. But if they're regular, that means they're symmetrical around the lesion. And here's another example of regular streaks where they're symmetrical around the lesion in a spitz nemus, and we have little linear projections of pigment at the periphery, but it's all around, so they're regular streaks. So it's not really adequate to say, I see streaks. In your mind, you want to think, are they regular or irregular? Everything you see, you want to determine if they're regular or irregular, and you have to learn the definitions. So irregular streaks are being defined as foci of streaks. There are streaks here and there, but they're not completely around the lesion. So we have in situ melanoma with linear projections of pigment at the periphery, but they're not around the whole lesion. And streaks can be associated with pigment network. They can be found by themselves, or they can be associated with dark blotches. So here we have an invasive melanoma with an irregular blotch and linear little irregular streaks coming off. So irregular streaks. And an invasive melanoma with an irregular blotch and irregular streaks coming off there at the periphery. They're not streaks at all points. And another melanoma with a large dark blotch, and we have some streak-like structures here, and they're irregular streaks because you don't see them at other points. So that's the difference between regular and irregular streaks, and you'll see them all the time. So a word about colors. Colors depends on melanin, where it is. Black typically is higher up in the skin, but of course, if you have heavily pigmented melanoma cells through the whole lesion, you'll see black color. Light brown and dark brown at the dermal junction. Gray always in the papillary dermis. And then as you go deeper, you see slate gray and steel blue. Hyperkeratosis can cause yellowish color, and red will be caused by blood vessels and inflammation. And the more colors you see, the greater is the chance that you might be dealing with something high risk. And also the colors can help you determine if a melanoma is going to be thin or thick or really bad. So if you see a melanoma with black or brown and a lot of local criteria, then that points to being something superficial. But if you see these deep colors, then it's going to be invasive, deeper melanoma. So let's talk about regression and hypopigmentation. Regression, the more regression you see in a lesion, the greater is the chance it might be high risk. So it's irregular white scar-like areas. So here we have irregular white scar-like areas. So regression versus hypopigmentation, we say it should be bony white or milky white. So the white color should be lighter than the surrounding skin. And you can see here that there's this bony white, irregular scar-like coloration in the melanoma. And another area of regression white color, and it should be lighter than the surrounding skin. Associated with regression or by itself or in other pathology is what we call peppering. I talked about that a little bit before. It's a little grayish pepper-like granules and represents melanophages and free melanin in the dermis. And here it's part of lichen planus keratosis. Here's resolving lentigo. But you can see it in regressing melanoma. You can just see it by yourself in older patients. So regression area may be bony white, milky white, with or without peppering. And the peppering might not always be granular. Sometimes you might just see little grayish coloration. And here we have another example of peppering. You can see this better if you were looking at it actually on the patient. This invasive melanoma has a big bony white area of scarring, and here is peppering. And so it's part of the regression structure. So hypopigmentation is never bony white, it's never milky white. And the way you might tell the difference between white here, regression, and hypopigmentation is that you never see gray color with hypopigmentation. It's just a light tan color, and it's never bony white or milky white. So here's regression structure and hypopigmentation. Light tan color. And here's an example of hyperpigmentation and hypopigmentation, just a light tan color. And here we have hypopigmentation. And multifocal hypopigmentation is commonly seen in dysplastic nevi. So another variation of colors you'll see is the famous veil, and it's defined as being a regular bluish white color, maybe with a ground glass appearance, but it does not fill most of the lesion. So we have this bluish white color, it's called the veil. And on the other side here, here we have veil, so bluish white color. Doesn't fill the whole lesion. And this is a veil, a bluish white color that is spitz nevus, and a bluish white color, many people would call it a veil. But experts have trouble many times determining if it's the true bluish white color of the veil or the bony white color of regression. So I think in my experience, white color in any form and blue color in any form in any combination should always be a red flag for concern. You're not always going to see the classic veil, and you're not always going to see the classic regression. So let's talk about vessels. Vessels are very important. You can see lacunae, hairpin shaped. It could be regular or irregular, comma shaped, arborizing or serpentine, dotted, pinpoint vessels, glomerular, string of pearls, linear, which can be regular or irregular, corkscrew shape, polymorphous is many different shapes in a lesion. And then you can see milky red areas or pink color with or without the milky red globules that I showed you before. So polarized dermoscopy is really a better way to see vessels in a lesion, and they give you clues to what's going on in their important structures to be able to understand or identify. So here we have the classic lacuna, the well-demarcated vascular spaces. And one of the colleagues sent in a case that we maybe hopefully will have time to look at that had well-defined vascular spaces. And also you can see fibrous septa is very common and in lacuna. And here we have darker, well-demarcated vascular spaces. So if it might be bright red if the vascular spaces are superficial, and if they're deeper in the skin, they will be darker. And here we have other well-defined vascular spaces and some fibrous septa. And here we have well-developed sharp lacuna. So it's really important to see if they're sharp, because if they're not, you could confuse them with milky red globules. Then there's hairpin-shaped vessels associated with seborrheic keratosis, and they might be the major clue that you're dealing with a seb-ker. This was a pink lesion. Of course, there's miliasis here, but it's full of hairpin-shaped vessels. Hairpin-shaped vessels are not only seen in seb-kers. You can see them in squamous cell carcinoma, hairpin-shaped vessels, and hair-shaped vessels. And you can also see them in melanoma, so they're shaped like hairpins. Comma shape are associated with benign nevi. They look like little commas, but they can also be part of a polymorphous vascular pattern that you can see in melanoma. And here we see a little comma-shaped vessels that look like little commas, so you're going to see them. Then there's the famous branching arborizing vessels, and they're associated with basal cell carcinoma. They're thinner and they're different caliber vessels, but they're always in focus because they're on the surface of the lesion and they're branching. And I think that's a good description. So they're in focus, branching, different caliber vessels, and like I said, they're always in focus. But you don't always see them in basal cell carcinoma. Here we have a regressive melanoma with arborizing vessels, and here we have a nodule that has some arborizing vessels, but it definitely was not a basal cell. It turned out to be Merkel cell carcinoma. So they are not diagnostic of basal cell, but you can see arborizing vessels in basal cell, melanoma, Merkel cell carcinoma, nevi, sebaceous gland hyperplasia, sun-damaged skin, scars, and NLD. Recently, I saw that, and AI system read it as being malignant, but it was just because of the vessels. Then there's the cute little serpentine snake-like vessels. It's a good metaphor. They're little, they can be thin or thick. They're not really branching, but they look like little snakes. I think it's a good metaphor. And this is a basal cell, doesn't have arborizing vessels, and serpentine vessels might be your clue, the only vessel that you see in basal cell carcinoma. So here we have little serpentine vessels. And here's a basal cell, and here we have some serpentine vessels, and they are very important to help make the diagnosis. Then moving on to linear vessels, they can be regular or irregular, and if they're irregular, this is a big milky red area with milky red globules and linear vessels, so that's them. And here we have a milky red nodule, amelanotic melanoma with some linear vessels, so they're just straight. They're not long, they're just little straight vessels. Then there's the dotted vessels. They're little dotted or pinpoint, and they can be localized or fill the whole lesion. And here we have, this is Bowen's disease. And I can tell you that psoriatic lesion or plaque would look like this. They definitely have dotted vessels filling the whole thing. And here we have a hyperkeratotic pink spot if it's on the sun exposed area, and in an older person and you see dotted vessels. In my experience, it's almost always going to be a Bowen's disease. And here we have some dotted vessels in a melanoma, and some dotted pinpoint vessels in a Spitz nevus. So a variation of the dotted vessels are glomerular vessels. They're coiled and they're bigger, and I think they're just a variation of the same thing. You can see them filling the whole lesion, or you can see foci of glomerular vessels, and that's associated also with Bowen's disease. When you see the dotted vessels and you have the time, you should look to see if they're linear or curvilinear. If you see dotted or pinpoint vessels or glomerular vessels, here it's curvilinear or linear, and over here it forms like a little necklace. And that's, as far as I know, diagnostic of clear cell acanthoma. So it's really important to try to look at that if you want to make that diagnosis. Corkscrew vessels, they're just irregular. I hardly ever see them. They're associated with melanoma and metastatic melanoma. And then very high risk is polymorphous vascular pattern, where you see three or more different shapes. You can see comma, you can see linear, you can see dotted, and that's a polymorphous vascular pattern. Here we have basal cell-like, comma, there's linear and dotted. So when you see a lot of shapes, it's always a red flag for concern. It's polymorphous vessels. Milky red area associated with amelanotic melanoma. It's a pinkish white color. May or may not be associated with milky red globules. And here we have milky red globules. They're out of focus little round structures, not to be confused with the lacuna that you see in hemangioma. So these are milky red globules in milky red areas of amelanotic melanoma. And they also are thought to maybe represent neovascularization. So milky red areas, it's a big milky red area, and here's a little milky red globules. So the melanoma specific criteria in the trunk and extremities, melanoma specific just means they're high risk. Asymmetry of color and structure, multi-component global pattern, irregular pigment network, irregular dots and globules, irregular blotches, irregular streaks, regression, crystalline structures, lots of blood vessels, milky red areas, and a lot of colors. So here's a question. What is this? What are these structures here? What are these structures here? Regular dots and globules, irregular dots and globules, regular blotches, or irregular blotches. So what are those structures?
We'll launch the poll.
Yeah, we can do that. So I can't vote. So how do I get to the answers?
Just
They're gonna come.
a chance to.
Yeah, I don't think we're gonna have time to go over my questions because you said we have to do this in an hour.
Give him 3 more seconds. 3, 2, 1. Okay, that's it.
So what's the answer? Oh, that's the answer, irregular blotches. Okay, so not everybody, okay. So let's go to the next. So what are these structures here? The little pinkish structures.
Maybe you should show the slide a little bit longer.
Sure, okay. I'm new at this, actually. I've never done this before.
Yeah, that's fine. Okay, we'll launch the same poll. What are these?
Okay, so you read them. Read the answer. Or and tell me when I can go to the answer.
We'll let half the people vote. Let's see. All right, that's it. We're gonna go.
So they're milky red globules. Good, very good. Okay.
Okay.
So what are these things at the periphery? Linear projections of pigment at the periphery.
Show the slide. Show the actual lesion.
Yeah, I am.
There it is. I couldn't see it. Okay. So what are you asking for? Those.
What are they? What is it?
Okay.
Regular pigment network, irregular pigment network, irregular streaks, or regular streaks. So what are they?
Okay. 3, 2, 1. All right, that's it.
So they're irregular streaks. Good.
Yes.
Excellent. Okay, and what are these white network-like structures here? What is this?
We see this. We see your answers. Okay, show that. All right.
So is that white network, pigment network, regression, or veil?
All right. 3, 2, 1. Okay.
So it's white network. So we see the answer. Good. So the world is smart. Good. Good guys.
Doing good.
Okay, now we're talking about site-specific criteria on the face, follicular pigmentation. So you want to know if it's regular or irregular pigmentation. So these are follicular openings, not to be confused with milieu-like cysts. And the pigmentation is around it symmetrical, so that's good. But here's the big one, asymmetrical follicular pigmentation. The atypical malignant melanocytes and melanoma on the face produce pigment irregular around the pigment. So you see irregular coloration around the follicular openings. And in my experience, most of the time it's different shades of brown and black. Of course, it can be grayer if it's deeper down in the follicular openings. So here we have follicular openings with asymmetrical pigmentation around them. So it's really important to be able to determine this criteria. It's not always going to be this obvious. So we have asymmetrical follicular pigmentation. These are melanoma cells producing pigment, and it's irregular. And here it's very obvious, but over here it's very subtle. So in my experience, and I see a lot of pigmented lesions, little flat lesions on the face. If you see asymmetrical follicular pigmentation in any form, in my mind, it could be a lentigo, pigmented actinic, pigmented bones, or lentigo malignant. And in my opinion, you should do a biopsy. And if you're not sure, and I've had patients with multiple flat pigmented lesions on the face that look the same clinically, and they look the same with dermoscopy, and they're different. Then there's the strawberry pattern, which you heard about before, where you have follicular openings, but the pigment pseudo network is really just like a pinkish irregular coloration. So it's a strawberry pattern, and I like that, and you see that very often. So next thing, structure on the face are rhomboid structures, And really, you don't need to look for rhomboids, just it really means complete thickening or complete pigmentation, irregular pigmentation around follicular openings. So they don't look like rhomboids mostly, it's just complete pigmentation. It's not partially pigmented. So we have complete pigmentation, irregular around the follicular openings, around where it structures melanoma criteria. And this looks like pigment network, but it's just combined, rhomboid structures, complete thickening or complete pigmentation around the follicular opening. So melanoma criteria. Then there's annular granular structures, which are also associated with melanoma, but not always. And they're little, can be brownish or grayish granules around follicular openings. And here is the solar lentigo. And here we have little annular granular structures of melanoma. Annular granular structures, little grayish, and they can be atypical melanocytes or melanophages, and annular granular structures. And then there's circle within a circle. It's a relatively new criteria. And the circle here, inner circle is a hair follicle, and the outer circle can be brown or gray, and it can represent atypical melanocytes or melanophages. So if you see a large lesion typically on the face and you see a little spot with annular granular structures or those other criteria, that would be where you would do the biopsy. Circle within a circle, circle within a circle. So here's a true or false question. And we didn't talk about the fingerprint pattern yet, but we're going to do that next. The lines of the fingerprint pattern are parallel, forming swirls and arches, versus the pigment network where the lines are reticular and net-like. So is that true or false? So we can vote on that. So the fingerprint pattern parallel versus pigment network on the trunk where they're reticular and net-like. Is that true or false?
All right. 3, 2, 1. All right, that's
true. So I'm sure everyone got this one right. Oh, you're geniuses out there. I'm very happy. As a note, when dermoscopy started, it was like pulling teeth to get people to dermoscopy. People thought that it was a terrible technique. It was worthless. If you had a good pair of eyes and you could do a biopsy, you didn't need dermoscopy. But you're all very smart out there. So solar lentigo, which I don't think they're all flat seborrheic keratosis, is not possible in my mind. Clinically, phenotypically, and histopathologically, they're not all the same, but you're taught that. But you get the fingerprint pattern where there are parallel lines, and here we have parallel lines on the left, and they can form arches and swirls. And so if it's not reticular then, and it's parallel, then it is probably going to be the fingerprint pattern. And they can be broken up, but when you want to look for the parallel lines. And another feature of lentigo is what they call moth-eaten borders, or sharp, concave indentations, and that would be a clue. Plus we have the fingerprint pattern here with the parallel lines. So these are sharp indentations, concave, and they're called moth-eaten borders. I think that's a good metaphor. Moth-eaten borders. Okay, question, benign or malignant? Let's not go vote because we're taking too much time. So do you think that's benign or malignant? So what you should be thinking in yourself, in your mind, of course, I've got to look at it with dermoscopy because you can't tell. It's a nothing looking spot. So now we can vote on this. Is this benign or malignant? We can vote on this one. So what are you thinking in your mind? Are you seeing the fingerprint pattern, or are you seeing criteria associated with the melanoma? Not always obvious. But I think you're smart. The world is smart. Very smart world. I'm very, very proud of you. Very proud of the world.
It's close, Robert. Okay.
I can go?
2, 1.
Okay, so what do you say it is? Okay, so it's it's malignant. Asymmetrical follicular pigmentation. These, you don't always clearly see the follicular openings, but look, there's asymmetrical, here's a follicular opening and there's asymmetrical pigmentation. So it's one criteria which is hard to see, like Dr. Lala said last week, but you can diagnose melanoma really early by finding it. Even the slightest suggestion